on the 31st of December, the year of active aging closes officially. And the reflection I made with MEUSAC was what happens after that. And so I offered to reflect on the longer-term agenda for active aging with a health perspective. And I do that because if we're going to talk about active aging, we need to clarify that, or maybe widen that, to say we're looking at healthy active aging. And how do we go about analyzing in our own society how we are going to have these more active elderly persons who remain healthy throughout their their lives, not just their working lives, the life in a volunteering opportunity, the life in a caring opportunity, the life in a learning opportunity. And this long list of classical ways of measuring healthy aging, which you read in papers and scientific reports about, we heard most of these today in these 3 hours we've been together, with aging and life expectancy and disability-free life expectancy and life satisfaction and mental, psychosocial health, and all that list. This is the classical list of studies that are thrown at you when you talk about healthy aging in the scientific world or in the professional world. And so if from a professional's perspective, I think this is what we've been hearing throughout today. But I've looked at some reports which give us a different type of perspective. And you will gain no marks by guessing what I have written at the bottom of that, because healthy aging is also about accomplishments in life. It's about enjoying a diet, enjoying eating. It's about financial security. It's about good neighborhood, security, good physical appearance, sense of humor, productivity, contribution to life. So no marks for understanding that when you ask older persons themselves, it is this perspective which comes to light. So we have to be very careful in analyzing situations like health, that we are addressing what older people's perspectives are of what it means to be healthy whilst you're aging. And I would like to give you some examples from Malta, because this is the environment I work in, about health in Malta and what is the situation, or what will be the situation. As you can see from this slide, we have at the moment, on a global basis, 11% are aged 60 plus, will be double that in 2050. But if you look at the Malta figures, we are already at what the global figures are in 2010, and we will be double that by 2060. And so this is a reflection that needs to be made, that we are already in the situation where we have serious issues of demography. This slide, and I have a next one with females after that, gives you a perspective of a very disturbing feature. As you can see, the brown is life expectancy. At what age do you expect to die when you reach 0, 1, 35, 55, 65, 75? So, if you were 75 in 1948 and you were a male, you expected to live to 83.2. The bad news is that if you were 75 in 2010, you expected to live 83.8. So, with all that has happened up to now, in terms of trying to improve quality, we have definitely made strides and improvements at the younger age groups. As you can see, if you were born at birth, it was 55, today it's 78. At 1 year, it was 65, it's now 79. But as you can see, we have a very disturbing situation when we come to 75 plus, which to me starts painting a picture of saying, can we continue to use today's systems and methods for tomorrow's aging population? That is the situation for females. As you can see, females have continued to outlive males throughout the whole age spectrum. Interestingly, the maternal services and the maternity services have made a difference in the 1948 to 2010 differences. That is maternity services all the way, improving the fare of women. But again, a woman who was 75 in 1948 expected to live to 83.8 years, and in 2010 expected to live 87 years. So when we look at this picture, we need to understand a bit better and reflect a bit better on a few more situations. What is the situation today concerning old persons? 81,000 people age 60 plus today. 4,500 of them are living in sheltered environments, long-term care. But 76,000 are living in the community. Look at that figure, 76,000. It will be double that in 20, 30 years' time. Can we sustain that type of situation as we grow older, all of us? Now, these figures come from KMPD. KMPD registers people aged 60 plus who apply to KMPD for services. As you can see, in the community, there is a lot of impairment amongst people living normal, inverted commas, lives in the community. We have to realize that people living in the community have impairments: physical, visual, hearing, intellectual, psychological. And most importantly, we have 16.3% who have multiple impairments. This is persons living in the community. So, apart from a demographic tide, we have an enormous situation concerning disability. This is what we have at the moment. We have geriatric services, we have specialization in geriatrics, we have geriatric rehabilitation, we have long-term care beds, 4,451 of them at last count, between public, private and church. We have day centers, we have night shelters, we have telecare, we have incontinence services, we have handyman. This is courtesy of the Parliamentary Secretariat for the Elderly, who gave me these figures. And you have also my office, the Office of the Commissioner, trying to look at the rights and interests of older persons in the Maltese community. We were established last year to promote and awareness to matters relating to rights and interests of our target groups and safeguard and protect our rights, hence our logo to promote and protect. But beyond that, what we did in our office, we examined the extensive priority issues that EU active aging agenda on health and healthier active aging. There were 15 or 16 issues raised, and looking at what was coming out of what we were seeing in the situation locally, and we felt that we should identify a few priorities and reflect on a few priorities. If you feel they are not, then you're entitled to your own opinions. We felt that these were issues that merited attention. The risk of falls. The risk of falls is an issue which needs reflection with our elderly population. Polypharmacy. If you have ever sat in a pharmacy, in a health center, or anywhere else looking at lists of medicines that old people take, I mean, it is worrying. Undernourishment. Yes, in a population which is made of obese people, there are risks of undernourishment, and we'll discuss this a bit more in detail. A very serious issue is chronic disease management. We know we have a high prevalence of diabetes, hypertension, cardiac disease. we need to reflect a bit more about how we are managing chronic disease at this point in time. And finally, to have a wider approach, which is a health but also an environmental issue, I think we need to also reflect about age-unfriendly environments. These, I feel, are the challenges that we need to reflect upon beyond 2012 if we want to have a healthy, active, working, aging population. And I only here give a few ideas. I think this is the debate here still open. We need to, first of all, falls are very common in the home and in normal living environments, pavements, streets, etc. Prevention here to address this is urgently required. There are 4 prevention policies in most hospitals and homes for the elderly, but again, incident reports, are they analysed? Are the causes identified? Are they blame-free systems? Polypharmacy. Are prescriptions monitored? Do we have sensitivity towards age-recommended prescription dosage? Side effects and cross-interactions. Professional awareness is obviously very important here. Awareness among the old people and carers themselves. One area where one could actually focus more on this issue is when new cases are admitted either to an acute hospital or rehabilitation or long-term care, where one can have the opportunity to review the treatment that people are receiving. Malnutrition. Malnutrition, yes, if somebody ends up in a bed for 8 to 10 days, they are at risk of malnutrition. And there are issues there of care. There is also a question of dependency and whether people who are dependent on others, especially particular winter or festive holiday seasons, are or in a situation where they can take care of themselves. And another issue would be temperature control there. Chronic disease management. Chronic disease management is possibly the issue where we need to involve more patients, carers, elderly, to be more empowered to take care of their own health. We need to move away from existing protocols targeting people outside in hospitals to people living in the community. And how can I continue to live in the community co-live with my diabetes, with my hypertension? And there are issues here about remote monitoring and testing technology which are coming online, very interesting things which will allow a person to continue living a normal life, sticking oneself to a mobile phone, a smartphone, and getting readings of hypertension and blood glucose without the need to go to a hospital. But this needs more involvement at primary care, the old persons and the relatives themselves. Age-friendly environments. Age-friendly environments are important in order to keep a balance and how we can help people to remain healthy, independent and autonomous throughout their lives. And I do advise here a reflection on whether our citizen communities are supportive or really supportive of our older persons, and this may apply to women with pushchairs and pregnant women and children as well, in the built environment, in transport, housing, communication, social participation, etc., civil participation, respect and social inclusion, which are issues and areas where we tend to sometimes forget that there are dimensions requiring older persons with different agendas than the rest. What is the vision? The vision is we need a more inclusive and a more active contribution in all areas of community life by older persons, but we need to give them the space for that. We need more flexible responses to needs and preferences, and that is something which needs to be inbuilt in whatever we are trying to do. And finally, we need a more friendly physical and social environment. We've heard today a lot about work. We've had sports for older persons, and I think this is a very good thing. We have social clubs, but in the end, it's all about quality of life in old age. If we are not going to make the reflection about quality of life or improving quality of life, we will not have a healthy, active living society. Thank you very much.